Ohio elects the president, doesn't matter which party, and they forget about Ohio for 4 years, and I'm just not going to let that happen. But about a month ago, I had dinner with Jason Furman, who next to Larry Summers is the president's top chief economic advisor. As I was with Furman, and I was talking to Furman about your question and about health care generally. He said every time he sends a memo to the president about almost any subject, the president will handwrite on the memo as it sends it back almost always something about what impact does this have on passing health care? What impact does this have on not necessarily the public option, but on health care as a whole? And the president understands this is his major, next to the economy as writ large, of course, this is the issue that matters the most to his legacy, to the American public, to his reelection, to his building a strong progressive tradition, to all the things that he cares dearly about. So that's why I think we're going to succeed.
First, thank you. Is it on? First, thank you very much for the leadership that you had for so many years on this. I remember hearing virtually the same speech sitting next to you on a Southwest flight about 6 years ago. So it's not something that came to you.
That's a compliment.
It is. I heard the same thing. And your daughter actually was sitting in the middle, and she had to listen to these two men, grown-up men, talking about it.
And you were doing work in Israel then, if I remember.
Yes,
right?
at the time.
Yes.
Yeah. Still the accent. But really, I wanted to talk about the other 900-pound gorilla in this room, which I call basically the healthcare food chain that has not been mentioned. Really quick example. If a woman, for example, is unfortunately getting diagnosed with ovarian cancer today, she'll undergo multiple surgeries, get expensive medication, cost the healthcare system about $250,000, and probably die within 1 year. If they find that cancer early on, that the healthcare system would reimburse the company that made that test $50, and the woman would be alive today. When I go to venture capitalists, we develop a test, for example, one of many, and I cannot get a single venture capitalist to actually look at us because they're simply saying the CMS system is screwed up. The reimbursement system is such that they don't recognize the inherent value for the system in making that test available, and I would like to hear your opinion about it.
That's a very good question. That begs the issue of a question that I expected, and I imagine will still come if there's time, on the cost overall of how we pay for what we're going to do here. And I will go into more detail if asked later. But one of the ways is a different method of looking by CMS and by Congress and by the President of looking at what we reimburse, more on outcomes, more on preventive care. And you can show, yours is a great example. There are 6 examples if we all had a little bit of time to talk to each other and brainstorm in this room probably of how we could, particularly coming out of the hospitals, that they can look at all kinds of ways. And the Medicare doesn't reimburse for the program in Mansfield I mentioned they're struggling because there's not sort of a revenue stream to do this and save money and save lives. So I do think that that the focus in this health plan will be a big component of that, and by illustrate that by Senator Kennedy, back when we started this discussion, I believe it was probably summer. I think it was right before he got sick, and so I think he got sick in May, June, July of 2008. It was around that time, and he instructed 3 people. He wanted three sort of the committee to break down into the Health Committee, Health Education Labor Pension Committee, to break down in 3 groups. We'd all work on each of them, but he wanted a focus on access, on quality, and on prevention. The access was originally Hillary Clinton. She's a member of the committee. Then she obviously left, and now it's Jeff Bingham, and it's mostly the most senior members that are sort of running this. The quality is Barbara Mikulski from Maryland, who's been involved in health care issues for a long time, and the prevention is Tom Harkin of Iowa, who is sort of I'd say the leading voice in the Senate over the years on dealing with prevention, and we're talking about these kinds of ways of looking at things differently and saving huge amounts of money and helping as one significant way to pay for health care reform. Thanks.
Sure. I'm a simplistic way looking at things. Why most insurance company will cover the same things as a Medicare. The cost is they take over the same basis of that. Why can't we open the Medicare and give the option to businesses that want to pay into it and cover the people who are employees or other people who want to join directly?
I think that makes a lot of sense for Reed. I introduced a bill 10 years ago with then Congressman Stark and Senator Moynihan, and President Clinton was very supportive of it. It was a Republican Congress. It didn't go very far, but it started a discussion to move the Medicare eligibility age to 55. And we constructed it in a way that it was revenue neutral rather than in those days, maybe $45, $50 monthly premium that a Medicare beneficiary pays who's over 65. The premium was something like $400 a month because it made it revenue neutral. And that was the idea, that this wouldn't cost a lot more money, thinking that was the way we got to some universal coverage. The opposition to that, to any expansion of Medicare, is so acute and so overwhelming by the healthcare interests that he talked about that that went nowhere. And I think your idea, while to me it's a pretty clean, open idea, probably wouldn't. The politics of it wouldn't work. I think the actual, in reality, the changes in the law would, but I don't think the politics would. I think that's why President Obama didn't think of doing it in that way.
Hello, my name is Michelle Mahan, and I'm a registered nurse with the National Nurses Organizing Committee. You may be familiar with our group if you saw Bill Moyer's special last Friday night about health care reform. Obviously, no discussion of health care reform can be complete without including the nursing profession and the crisis that it faces. And with all of the other cost-saving interventions being discussed, such as information technology and improved billing practices for the insurance industry through that, I think that no one can deny that that nurses are the foundation of our healthcare system, and that currently there are many lives being lost due to unsafe staffing conditions in our hospitals. Many lives and much morbidity and increases cost as well. With that in mind, would you agree with your colleague, Senator Boxer, that this needs to end? And would you support the National Nursing Reform and Patient Safety Act?
Okay. I thank you for your question. Thank you for your service as a nurse. I don't know what the bill does. I have been very supportive of higher staffing levels. I've been very supportive of collective bargaining rights for nurses, as you would guess. I've been very supportive of finding ways to train new nurses. To me, we have our policy towards health, I'll go off on a tangent, then I'll try to get back. Our policy towards training healthcare professionals, less those PTs, OTs, occupational speech and hearing, nurses aides, LPNs, all of that we've not done it the way we should have. When we have to import nurses from poor countries that frankly, and I don't blame them, I don't blame our hospitals for hiring them, I only blame our system that we're hiring nurses from poorer countries that can't afford to train, that have scarce dollars to train nurses, and then they leave their country and their public health system continues to wither. To me, we need to fundamentally fix that. That's not your question. Your question more directly, I think we need to, as long as we're not funding hospitals and not funding health care kind of the right way to push down care, if you will, to more primary kind of care and helping those and paying decent wages to those in the sort of lower and medium levels, we're going to continue to fail in a lot of ways with health care. So I agree with your sentiments. I will look at the legislation. I think it's a pretty big picture question that way. Thank you.
Today at the City Club of Cleveland Forum, we've been listening to the Honorable Sherrod Brown, Senator from Ohio. Thank you, Senator Brown. Thank you, ladies and gentlemen. This forum is now adjourned.